Welcome to the Medicare and You overview presented by Minnesota Nurses Association. Making the right Medicare choice is one of the most important decisions you will make, and your choices can have a significant impact on the quality of your retirement. Please review these slides carefully and jot down notes so you better understand the next steps in deciding what Medicare plans work best for you and your family. MNA developed this presentation to provide you with an overview of Medicare and the options it offers. Many of the acronyms and different pieces of Medicare can seem confusing and overwhelming. There are several choices that you must make, and some of those choices have long-term consequences for you and your family. We encourage you to review all the material we've provided for you and use the resource list and call your local senior agency in your state to get your specific questions answered. Everybody's situation is different, so always be sure to check the rules and regulations so you make the right decision for you and your family. There are 4 distinct parts to Medicare. Part A covers inpatient hospital and skilled nursing facilities. Part B covers most outpatient procedures like lab, x-ray, and physician visits. Part C is also known as Medicare Advantage. Often Part C is also referred to as a Medicare HMO. Part D is the Medicare Prescription Drug Program. We'll go into more detail later about how each of these pieces work and integrate. You should also look at these slides and know what the cost sharing portion is of each piece of Medicare. This is an example of a Medicare card. You can see that it's got Medicare's phone number on it, it has your name on it, and then it's got this Medicare claim number, and Medicare issued new cards to Medicare eligible beneficiaries a few years ago, and all the new cards have a special ID number on it, removing your social security number so that your identity is protected. You can also find out, as you can see in number 3, that if you're enrolled in Part A or Part B of Medicare, and then number 4 you can see gives you the effective date of your coverage. This is a handy way to get some good information and also find out if someone asks you if you're enrolled in Part A or B, you can simply show them your Medicare card. If you have chosen to enroll in the traditional Medicare plan, you will most likely want to consider purchasing a Medicare supplement plan, often called a Medigap Plan, to help you pay for some of the out-of-pocket costs not covered by Medicare. If you purchase a supplemental plan, you will have your Medicare card, the card that we looked at in the prior slide, and a card from the supplemental insurance plan indicating that you have a Medicare Gap or a Medicare supplement plan. If you choose to enroll in the traditional Medicare plan, you will also need to enroll in a Medicare Part D prescription drug plan. After you enroll, you will receive a separate card for your Part D coverage. These 3 cards, the traditional Medicare card, your supplement card, and your Medicare Part D prescription drug card, may cover most or all of your out-of-pocket expenses for traditional Medicare. Medicare open enrollment is from mid-October to December 7th every year. Generally, traditional Medicare, Medicare supplement plans, and Medicare Advantage have some changes, and some of these changes may impact your coverage or the providers that you can use. Be sure you open all the mail that you receive and review it carefully in case there's any changes that might be coming up that impact your coverage. When you first become eligible for Medicare, you should know if you need to enroll in Part B. Unless you are actively employed or receive employer-provided coverage from your employer or your spouse's employer, it is important to enroll in Medicare Part B upon reaching Medicare eligibility. If you do not enroll in Part B and do not have access to employer-provided coverage, there are stiff penalties for late enrollment in Medicare Part B, and often these penalties can be permanent. Now we'll look at your options for enrolling in Medicare. Traditional Medicare has what's often called a PPO, or you must use a preferred provider. This means you can go to any provider that accepts Medicare. You do not need a referral to see a specialist, and you have more freedom to direct your own care. If you enroll in traditional Medicare, you will also want to select a Medicare supplement to pay for some of the out-of-pocket costs required in traditional Medicare. Medicare cost plans are no longer offered in certain counties in Minnesota and Iowa, and we'll have a little bit more on that later. But the cost plans act very similar to a Medicare Advantage plan, but provide a greater access to providers. Medicare Advantage is often called a Medicare HMO. You must use a network provider on the HMO list, and generally your primary care physician then directs your care. Just to give you a sense of what's covered under traditional Medicare Parts A and Part B, we've listed a few of the benefits. Traditional Medicare includes deductibles, co-payments, and co-insurance. Be sure you review the Medicare and You booklet you have or will receive from Medicare. Become familiar with what's covered and not covered and what your share of cost is under your Medicare plan. Also remember that long-term care is not covered by Medicare. If you are interested in purchasing a long-term care insurance plan, you should contact your local Department of Aging agency, and they'll be happy to help you with the plans that are available in your state. If you decide to enroll in traditional Medicare, you will want to consider purchasing a supplemental or a gap plan to cover out-of-pocket costs not covered by Medicare. This slide gives you a brief overview of how a Medicare supplement plan works. Supplement policies vary by state, and you can use the resource list we have provided to you and call the number to see the policies that are available in your state. Supplements require a monthly premium. Generally, the more generous the coverage, the more expensive the plan. A Medicare supplement does not cover Part D drug coverage. You must purchase a separate insurance policy for Part D. And please remember that if you do not enroll in Part B of Medicare within 6 months of becoming eligible for Medicare, you can be required to take a health screening before an insurer will issue you a Medicare supplement policy. Cost plans are still available in certain counties in Minnesota and Iowa. We'll discuss this in the next few slides. These plans have a contract with Medicare to provide comprehensive coverage to Medicare eligible residents. Cost plans require a monthly premium, and if you use an out-of-network provider, you might incur additional costs. Cost plans may include the required Part D coverage, or you may be required to purchase a standalone Part D policy. If you move outside the plan's service area, you will be required to re-enroll in a Medicare Advantage or return to traditional Medicare. And remember, if you've been enrolled in Part B coverage for 6 or more months and want to return to traditional Medicare, the insurance company offering the supplemental plan can require you have a health examination before issuing the policy. In 2019, the federal government discontinued the use of cost plans in counties where there are competing Medicare Advantage plans. If you live in a county where there were 2 or more competing plans, you should have been given the opportunity to re-enroll in another Medicare plan, either the traditional Medicare plan or a Medicare Advantage plan. Eliminating the cost plans in Iowa impacted less than 10,000 people, and the change went very smoothly. In Minnesota, the elimination impacted almost 500,000 people. While most seniors have settled into the new choice of Medicare plans, many seniors had to scramble to make sure that they had adequate coverage. The Minnesota Department of Aging and Senior Link continue to assist seniors if they are having trouble accessing coverage. The counties in the blue area are the counties where the cost plans were eliminated in Minnesota. The green counties are the counties that cost plans were allowed to continue. To make it a bit easier for you to understand, we have listed the 21 counties in Minnesota that cost plans can continue to be offered in. So if you live in one of these counties and are interested in enrolling in one of the cost plans available, you can contact the Department of Aging and they would be happy to assist you. For those of you that live in Iowa, we have listed the counties that can continue to offer cost plans in 2020. If you live in one of these counties, a cost plan may work very well for you. You must use a contracted provider, but you do have some access to out-of-network coverage. So see if you live in one of these counties. You can call the Department of Aging in Iowa and they will help assist you with the cost plans that are available in the county that you're residing in. One of the most important choices you'll make in your Medicare coverage is the choice of traditional or a Medicare Advantage plan. We've listed some important distinctions on the slide. Please review the list carefully. There are pros and cons to both options. You will want to be sure you are comfortable with your choice of providers, your choice of cost, the referral process, and your out-of-pocket expenses. Be careful about the resources you use when you're looking at your Medicare options and choices. There have been several concerns recently about the new Medicare website. Some of the accusations state that the website leads people to a Medicare Advantage plan or a Medicare HMO, inaccurate premium information which can mislead seniors about making these important choices. Know what your resources are and where you're getting the best information. We have provided you with a list of reliable resources titled Medicare Resources and Information. These advisors do not sell insurance and receive no commission or compensation from any product or choice you might make. The counselors are made available through government funding to provide non-biased assistance to seniors. In the YouTube in the following slide brings home why it's important to get unbiased information. Every state that MNA has jurisdiction in is on this slide, so please feel free to use this information to help you make the right choices.
Meet Sherry. Sherry is turning 65 and needs to sign up for Medicare, but she has received so much mail about it and has looked at so many websites, she's confused about what to do next. This is Carlos. Carlos always had quality health care from his employer and never had to think too much about it. Now he has Medicare, and it seems he's on his own to figure out when and how to make changes, or what it does and doesn't cover. Here's Justine. She's been on Medicare for years, but Medicare seems to keep changing. The costs keep going up, but her Social Security check doesn't. She's worried. Meet Dwayne. Dwayne's mother is losing her hearing, and she doesn't use computers. She needs Dwayne's help, but he's busy with a full-time job and finding it hard to figure out all by himself. Meet Susan. Susan doesn't understand why Medicare didn't cover a recent health care bill. This is Randy. Randy doesn't know the difference between his Medicaid cares for her and his Medicare coverage. Nationally, there are more than 55 million people on Medicare, and each day nearly 10,000 new people enroll. While Medicare seems to be daunting, it doesn't have to be. That's where SHIP comes in. SHIP is your state health insurance assistance program. SHIPs provide local, trusted, and unbiased help for Medicare beneficiaries, their families, and caregivers. Get face-to-face, personalized guidance on Medicare from trained and knowledgeable SHIP counselors who live in your area. SHIP is a government-funded national program with offices in all 50 states, as well as Puerto Rico, Guam, the District of Columbia, and the U.S. Virgin Islands. Visit www.shiptacenter.org to find your SHIP. For questions on Medicare, contact SHIP today.
Depending on your area, the SHIP program may also be known by one of these names.
If you are approaching Medicare eligibility, your mailbox is full of glossy brochures from the private insurers. You are most likely receiving emails with resounding testimonials about how good the Medicare Advantage plans are. Consider the source of this information. These marketing pieces are by private insurers and designed to get you to join their program because they will get your Medicare dollars. When Medicare was passed, it was not intended to be privatized, and there are now so many choices it's confusing to seniors who must sift through all of this information to make the right choice. Privatization makes enrollment choices more complex than they need to be. There's confusion in trying to shop for Medicare Advantage plans, and the Part D prescription drug plans have restrictive formularies, and does that match with the current drugs that you're being prescribed? All of this is being driven by ideology and not evidence. There's no evidence that market choice and competition are producing better health outcomes for patients or lowering the price. What it is doing is confusing seniors who should not be required to read the fine print to make sure that they are properly secured in their retirement for healthcare coverage. It is MNA's recommendation that you use your local senior advocacy counselor to get the unbiased advice before enrolling in any additional coverage. Medicare Advantage, or a Medicare HMO, is the alternative to traditional Medicare. These plans have an annual enrollment period, and once enrolled, you must stay in the plan for a year unless there are some very specific circumstances. Medicare pays all the Medicare HMOs a fixed amount per person to provide comprehensive health care services to those enrolled. Medicare Advantage plans cover all Medicare provided benefits and often offer additional benefits like dental, vision, and gym memberships as a covered benefit. What's all the privatization about? The Medicare Advantage plans are some of the most profitable plans for health insurers. The Kaiser Family Foundation recently reported that the annual gross margins in the Medicare Advantage market were about double the margins in the individual and group healthcare markets. These plans can manipulate billing codes, direct your care to the least expensive provider instead of the best provider, and can deny you the care you need. A Medicare Advantage plan may be the right choice for you and your family, but make sure you understand all the pros and cons before you enroll. This slide provides you with some of the pros and cons of traditional Medicare and Medicare Advantage. With traditional Medicare, you have more freedom to choose your providers. With Medicare Advantage, it provides one-stop shopping. There's no need to purchase a Medicare supplement or a Medicare prescription drug plan. With Medicare Advantage, it might be less expensive, but you might have a difficult time getting the referral you need to the specialist you want to see. With traditional Medicare, no referral is needed. You can go to any specialist that accepts Medicare. Medicare Advantage may offer additional benefits like dental, vision, and a gym membership. All of these are important distinguishments between traditional Medicare and Medicare Advantage. However, one of the most critical considerations is that if you enroll in a Medicare Advantage plan and don't like it, at the open enrollment period, you can transfer back into traditional Medicare. It will be easy, but the insurers offering a Medicare supplement can require a health risk assessment and decline selling you a supplement plan if they consider you a bad risk. This means you can go back into traditional Medicare, but you may not be able to purchase a supplement. So just know this in advance if you're considering signing up for a Medicare Advantage plan. Organizations that advocate for seniors are documenting the problems seniors are having with Medicare Advantage plans. These plans are denying care when seniors are older and more expensive to treat. They're finding that it can be difficult to get authorization through the utilization review process for surgeries and other treatments that they need, and that getting appointments with specialists can take an extraordinary amount of time. They're also finding that the HMOs are narrowing their networks, so finding physicians can be very difficult when an HMO decides to do that. Oftentimes, the benefits and additional benefits that were offered when you enrolled can be removed, and the costs continue to go up annually. So these may be some of the challenges that you face if you enroll in a Medicare Advantage plan, and just be sure you're comfortable with that before you make the decision to enroll. On the other hand, a Medicare Advantage plan might be the right choice for you. You need to know what you're getting into before you enroll. So know if the providers you trust and want to see are on the network. When you enroll, know that you will be in the plan for a minimum of 1 year unless there are some very specific circumstances that allow you to get out. You will need to enroll in Part A and B of Medicare, but you will not need to purchase a Medicare supplement plan or a Medicare Part D plan. If you return to traditional Medicare and want to purchase a Medicare supplement, it is not guaranteed issue, as we mentioned on the earlier slide. You will most likely be subject to underwriting, particularly if you have a medical condition that's expensive or requires an expensive medication. We have provided you with a resource list and a checklist to assist you in your choice of Medicare plans. We encourage you to review the material we provided to you and to follow up with your local Department of Aging before signing up for any medical plans. These are unbiased counselors that can help you with the selection that's best for you. It's the best well-kept secret in your state, so be sure you use your local Department of Aging before signing up for any Medicare plan. MNA is very proud to be a sponsor of the Medicare for All legislation, H.R. 1384, authored by Congresswoman Jayapal. H.R. 1384 expands and improves Medicare by extending it to all. By having everyone covered under one plan, it ensures the future of Medicare because everybody will be in one big risk pool. Older, younger, sicker, and the healthy are all covered under one plan, guaranteeing one single standard of quality care for everyone. Medicare for All generates savings by simplifying health plan costs and administration. And dental, vision, and long-term care are included because too often seniors forgo purchasing these benefits because they simply can't afford them, or an insurance company won't insure them because they are considered a bad risk. We encourage you to write or call your congressional representative and ask them to sign on to this important legislation. This is the solution to the healthcare crisis that ensures us all and gives us all the care that we need.